Hello, everyone. My name is Jude, and I'm here representing submission 36, titled Harnessing Artificial Intelligence and Big Data Techniques to Monitor, Manage, and Forecast an Epidemic, the case of COVID-19. This is one of the projects under the Global South AI4COVID Program that's funded by the Canadian International Development Research Center, as well as the Swedish International Development Agency. And the countries of impact of our projects are Botswana, Cameroon, Eswatini, Mozambique, Namibia, Nigeria, Rwanda, South Africa, and Zimbabwe. Throughout this project, I will be able to discuss how we manage to get policymakers to be part of the team that we've been working together, and how we manage to get locally relevant data that we have been using to inform policies in Africa. I will be equally be able to share some of the results that we have achieved with you. To start with, when COVID started, we put together a team of experts in artificial intelligence, data science, and mathematical modeling, as well as policymakers from institutions and universities across Africa, with the goal of developing a data-driven COVID-19 monitoring dashboard, develop an economic epidemiological model for scientists and policymakers, determine factors affecting non-pharmaceutical intervention effectiveness, examine non-pharmaceutical intervention effectiveness such as home quarantine policies, and then determine local spatial models for hotspot analysis, determine non-pharmaceutical intervention effects on healthcare demand, and determine the resources needed to provide treatment, and engage public and scientific community with the overall goal that to help policymakers in mitigating and suppressing future outbreaks, to evaluate the relative effectiveness and potential biases of non-pharmaceutical interventions, and to support local communication strategies to address mis and disinformation about prevention and treatment of COVID-19. How did we get there to where we wanted to get, or where we are right now? Well, we knew fully well that there was the link between researchers and policymakers in the country was broken. We equally were aware that the link between researchers and the community in Africa does no longer exist. The first thing to do was, well, researchers have the tools to address problems. Policymakers know what is happening in their communities. But policymakers see they conclude traditional rulers like the kings, the sub-chiefs. They know what is happening in their communities, but they do not have the tools. How do we ensure that the people with the tools speak with the people or work with the people that know the problem? How do we move from where the people with the tool create their own, what they think is a problem, solve it, and then go to the people that had a problem and say, this is a solution to your problem, when they haven't even listened to them, what the problem is. And so we started by saying, can we create a situation where instead of us researchers sitting here, we create a consortium that bring in these policymakers and they become part of the consortium. The local chiefs, the traditional rulers become part of the consortium, so that together we have people with the tools. Together, we have people that know the problem. Together, we have people with a problem. And by so doing, people with the tool will understand the problem and say, I have the tools, and be able to inform the people that have the problem on what they need to solve their problem. So when we did that, we ended up in a situation where we had a consortium, which is the Africa-Canada Artificial Intelligence and Data Innovation Consortium, that had traditional rulers, that had policymakers, that had people from local communities joining a consortium of researchers, such that working together as a team, they can provide solutions to the problem within communities. And they know what is happening in the community because they are represented there. So far, working with them, we have been able to have them sit on the table, tell them the type of data that they tell us the problem, we tell them the type of data that may be needed. Now it is us as a team discussing it. So which means that we are not going to them to request, give us this data. They know that their consortium, because they, the policymakers, are part of the consortium. Their consortium need this data to solve this problem that they have in their community. They now move out there and they collect the data. Using the data in our model, now we inform policies and adjust the models with time. Once we address it, we send it to the committee, we look at that, we get feedback from the committee, and then we adjust the model with time, and we ensure that we end up with a situation where we have something that's very excellent. And so going forward, what has worked for us? How did we manage to get this local relevant data? By ensuring that we didn't just go to policymakers and tell them, give us this data to solve this problem that you have. But we went to them and said, let's form something together to solve problems within our community. When we form something, then we tell them, they identify the problem, tell us, and then we tell them the tools that we have to solve them, and tell them what they need, what as a consortium, the consortium will need, not just us, but the consortium, including them, will need to solve that problem. And so far, we have been able to get that data that have been able to address the issue. Starting with COVID-19, when we started earlier on, we're able to get data to train an algorithm to estimate the underreported value. Just want to show here that based on the data that we had in the countries that we're operating, again, we did this for every local communities, but here I'm only showing for the whole country, the average for the countries. In the red here is the overall report rate. And we obtain a mean of just 33%. And the pink here is just the my case report rate. And we obtain a mean of 48%. Now, the basic reproduction number, which as you know, is the number of persons that will be infected if one infectious person get into a population that is susceptible. And based on the data that we're getting in the country, the red here represents actually the reported cases, the basic reproduction number based on the reported cases. And the blue here can represent the one that we actually estimated using using our algorithm that we designed. Looking at these, the average basic reproduction number in the continent, the true average basic reproduction number is 2.24, but the reported one in these countries that we had is 0.89, indicating there was no outbreak. There will be no outbreak in those countries on average, not in the entire country, in all these countries. We are equally able to look at the relative effectivity of the asymptomatic cases with respect to the mild, with respect to the mild cases, with respect to the severe cases. Sorry. With respect to the mild cases, sorry, and we obtained that the asymptomatic cases, the mean effectivity of the asymptomatic cases with respect to the mild cases was 0.53%, as well as the relative effectivity of the severe cases with respect to the mild cases was 1.26. And we went on to look at what proportion of the cases were mild, severe, and asymptomatic cases. And we realized that on average, 90% of the cases were severe cases. And then 48% of the cases were asymptomatic cases, and the rest of the cases were mild cases. We move on from there and move to a point where the next thing was, how do we determine the lockdown or what to close when school, should we close down school? Should we close down businesses? How do we get to that point? Well, we developed a stringency index for each community based on locally relevant data for that particular community. And whenever we go to each community, so we keep on monitoring it in real time. And when the stringency, when the index is up to a certain point, then we switch that on and be like, when the cases are up to a certain point, then we, based on how we link them, classify them with respect and determine an index for them, then we'll be like, at this point, this should be closed. This is what should happen. And so far, I must say that has really been very helpful in minimizing deaths in the continent. For the case of South Africa, this is how we are monitoring it. And making those recommendations in real time. And we now move on to be able to train a recurrent neural network to be able to predict if there's going to be an outbreak. And we have been doing this and being very successful, where if the value crossed a certain threshold value, then we know that there's a chance that there's going to be an outbreak. And we have been able to predict all the outbreaks before they occur in every little communities within the countries where we are operating right now. We are equally able to use the locally relevant information that we estimate, locally relevant data that we have, and the true case counter. We are now able, with a machine learning algorithm, to estimate. We are able to determine the hotspots in each local community. This is the case of Johannesburg. And I must say that for some communities, without our algorithm actually estimating the true case count, the case count that we actually identify was not actually in line. Was not the true case count that we actually identified did not actually indicate that those were, if you didn't take into account the true case count, you would not have identified that those were actually hotspots. But with the real data that we had and relevant information that we had, we're able to identify the real hotspots within those communities. Moving from there, using the data that we had, we could be able to request data that would help us within these countries to be able to optimize vaccination rollout strategies by being able to take the data and break it down into the most severe group of people to target into the less severe. And by training the algorithm to be able to predict, this group of people, based on their activities, based on the way they act, based on the locally relevant information given to us, we have more deaths coming from there because of that. And so if we vaccinate this, we'll end up reducing the number of deaths. Our goal with our vaccination rollout strategy was, how do we minimize the deaths? And so that with that, we succeeded to be able to do that in these countries where we are operating. I must say that once we have all this information, in addition to many more information that we have actually, or results that we have, we put in a dashboard for all these countries, for the policymakers, for the entire public, to be able to have access to. And we have been working with network companies in these communities to ensure that, in these countries, to ensure that they take this information and have in the phone, such that those who do not have smartphones or have data can still be able to access the information that we are providing across countries. This is the case of South Africa. When you go there, you have all the information for all the local communities in every country where we find ourselves, not just South Africa. And must end by saying that it's going to end with acknowledge the great work of all these team leaders that are leading the teams in these countries that are working on the project. Thinking of Miranda Tebo and Professor Gideon Wakuma that are working in Cameroon. I'm thinking of Bruce Milado and Pravesh Demba that are working in South Africa. I'm thinking of Josh Enorok as well, who is the Dean of Faculty of Medicine and Regional Delegate of Public Health and working with the team in Cameroon. I'm thinking of Oyele Oduala, Charles Chidumi, Angela Opara that are working with the teams in Nigeria. I'm thinking of Wilfred Ndifon and really acknowledging them, and the girl that are working with teams in Rwanda. At York University, I'm thinking of Jehong Wu, James Obinsky, Elias Gary, as well as Ari Ahmed. And I must equally thank Nazar Farouk as well as Fesayo from the IDRC that have done a great job in helping us. And I really appreciate the support and encouragement they have been giving us, being there with us throughout the entire project, what we've been doing, and have continued to be there for us. I must say, I really appreciate it. Words alone cannot express how grateful I am, but I want to thank you so much for the support and everything. And again, I want to thank you for listening. Thank you for spending time to go over our video. I'm looking forward to engaging with you during the panel session.